Hello, my dear doctor. I'd like to discuss a topic that is the bronchiectasis causes. All right. So bronchiectasis describes a permanent dilatation, circle the dilatation of the airways, secondary to chronic infection or inflammation. There are a wide variety of causes listed below. Causes include the post-infective, that is tuberculosis, measles, pertussis, and pneumonia. Cystic fibrosis, and also the bronchial obstruction, that is lung cancer, foreign body, immune deficiency, that is selective IgA deficiency, hypogammaglobulinemia, allergic bronchopulmonary aspergillosis, include the ABBA, we are saying the ABBA, all right, ABPA, and ciliary dyskinetic syndromes, that is the Cartagena syndrome and Young syndrome, and yellow nail syndrome. So the long list of causes, the bronchiectasis, is a very hot topic, my dear. So listen very carefully what happened actually in bronchiectasis. So in bronchiectasis, basically, the ectasis of bronchus, very simple. Bronchiectasis. So bronchial ectasis means dilatation, permanent dilatation. Why this dilatation? The wall became dilated. So the underlying pathophysiology and pathogenesis is the vicious cycle of infection and obstruction. So what happened, right, if the bronchus, and you see the lots of respiratory unit, right? So lots of respiratory units. So this is the, feel that this is the respiratory unit, right? This is the respiratory unit. So what happened, right, if a bronchus, you see that this is obstructed here. So distal to the part having an obstructed means the air is not passing and not outgoing, all right. So whenever it enters, something enters, the infections. So these infections will go, all right, will go, all right, will go there. So these infections leading to the bronchial wall infections. And these infections are also producing lots of exudations. So these makings, once again, more and more obstruction. So obstruction and infections is a vicious cycle. So if I am writing the obstruction and infection is a vicious cycle. So obstruction leading to infection, and these infection leading to obstruction. Once again, infection, obstruction, infection, obstruction. So these ways, the bronchial was getting dilated, all right? So if the bronchial was getting dilated, so getting the permanent dilatation of the bronchial wall, letting like that. So permanent dilatations. And if you see the permanent dilatation happen, this bronchial wall, here, so something like that, yes. So these infections causing lots of infection means the pus. So these pus expectorant always giving a produce sputum. This is called the bronchiectasis, all right? So bronchiectasis is a word that we need to remember. There's the single word that profuse, productive, foul-smelling sputum because of actitic walls. So a very important topic that I'm discussing now, that is the underlying etiologies. So let me start by the boxes. These boxes are really important. So the start is the bronchiectasis. So as I said, the bronchiectasis is nothing but the infections. So underlying etiology infections. So under the headings of infections, I can write the number one, that childhood pneumonia, pertussis. The way I'm writing, just write it down. Measles. So this is the bundle pack of the childhood history of the pneumonia. and ptosis and measles, and in their later lives they will develop the bronchiectasis. So one of the important causes is infection. Second cause of the infection is the tuberculosis that we need to remember. So this is the bundle pack of infections. Second bundle pack is an obstruction. Obstructions can be happened by, number one, that is by the foreign body. Number two, can be done by the lymph nodes. Lymphadenopathy, Ln plus. So lymphadenopathy can be done by, within the bracket, just write it down, TB, sarcoidosis, plus lymphoma. So this is a bundle pack of the lymphadenopathy. Next, number three is in cancer, right? Means the tumor can block, causing the obstruction, bundle pack. So these are the two important things with the infections and also the obstructions can leading to form this bronchiectasis, right? Yes, my dear, let me start by, yes, the number C is in heading. You see the infections is due to the immunodeficiency. Immunodeficiency will lead the infections, recurrent infections. And within the headings of the immunodeficiency, just write it down. That is congenital immunodeficiency. Means some of the primary immunodeficiency disorder, the most common immunodeficiency disorder that we need to know, IgA deficiency and hypogammaglobulinemia. Hypogammaglobulinemia and selective IgA deficiency, that we need to remember that congenital causes of immunodeficiency. Next is an acquired, all right? Acquired, of course, we know the AIDS means the HIV infections, right? Immune deficiency as something like that, immune overactivity. We can write. Means immune deficiency is something compared to the immune overactivity. Immune overactivity is something, right? This immunity is not working. So immune overactivity that we can, one of the diseases that we need to remember, that is ABBA. Allergic bronchopulmonary aspergillosis, ABPA or ABBA, we are saying, right? Second disease is the associated disorders. At least other autoimmune disorders that we need to think. One autoimmune disease that we need to talk, right? At least there is the IBD, another is the rheumatoid arthritis. Just write it down the way I'm writing, immune overactivities. And last E stands on the, yes, some congenital problems, all right? So congenital problems, once again, means the congenital problems. Most importantly, that we need to talk about, number one disease is the cystic fibrosis. Second disease is the ciliary dysfunction. Ciliary dysfunction, yes, once again, the two important diseases, that is Carter-Jenner syndrome and Young syndrome. And last is the yellow nail syndrome. So make a box, this congenital. So these are the causes, the 5 important points, right? Immunodeficiency and immuno overactivity, this bundle pack is nothing but the infection phenomenon, means the infection risk. And lastly, the congenital. Among these all listed of bronchiectasis, the most common cause in UK, bronchiectasis is the cystic fibrosis that we must remember, my dear. I'd like to discuss a little bit other topics as well. Just follow me what is written in your notes, my dear. Bronchiectasis describes a permanent dilatation, means the bronchiectasis management I'm discussing now, describes a permanent dilatation of the airways secondary to chronic infections or inflammation. After assessing for treatable causes like the immune deficiency, management is as follows. Means underlying etiology is management, yes, of course. Along with other management should be done for actatic walls. There is physical training, that is inspiratory muscle training, has a good evidence base for patients with non-cystic fibrosis bronchiectasis. Postural drainage and antibiotics for exacerbation plus long-term rotating antibiotics in severe cases. Bronchodilators in selected cases, immunization and surgery in selected cases like localized disease. Most common organisms isolated from the patients with bronchiectasis, that is Haemophilus influenzae, Pseudomonas aeruginosa, and Klebsiella species, and streptopneumoniae. So Haemophilus influenzae must be remembered. Start. So I'm writing another box, as because I have talked, right, the cystic fibrosis is the most common cause of bronchiectasis. The other than cystic fibrosis means I'm talking about the bronchiectasis management. So remember, I talk, right, the principles of the management of respiratory disease or chronic lung disease, starting with the general measures, then the specific medicine treatment, and then surgery have a role. Among them, the very specific points that we need to talk. Because of bronchiectasis, the productive, profuse, foul-smelling sputum, so we need to expectorate them all together. So the most important things, management of sputum, expectorate, all right? So bronchiectasis is nothing but the management of sputum. If I'm writing the sputum management is nothing but, just write it down, postural drainage as well as the physical training. Just write it down, physical training. Physical training. This is said that the physical training is inspiratory. The word will be helpful. I'm writing, my dear, inspiratory muscle training. Physical training means inspiratory muscle training, as well as the P4, postural drainage. So sputum management, of course, the physical training and postural drainage. And along with that, we need to manage with antibiotics. Sometimes we need the antibiotics for a long term. So just write it down, this box, and this box will be helpful, along with immunization, bronchodilators, and also surgery sometimes. That will be helpful. I'd like to discuss another topic here together, that is cystic fibrosis features. Presenting features are the neonatal period, around 20% meconium ileus, less commonly prolonged jaundice. Recurrent chest infections, 40% cases, malabsorption, that is 30% cases, steatorrhea, and failure to thrive. Other features, that 10% cases is the liver disease. Other features of cystic fibrosis is a short stature, diabetes mellitus, delayed puberty, rectal prolapse due to bulky stools, nasal polyps, and male infertility and female subfertility. So I'd like to give you a box of cystic fibrosis. Before going to the cystic fibrosis, my dear, I'd like to give a box, but yes, the cystic fibrosis we already understood that cystic fibrosis is an important cause, and the most common cause is the bronchiectasis. If I say the bronchiectasis equal to cystic fibrosis, is the most common in UK. So, another disease I would like to pick up from here, that is hypogammaglobulinemia. So I'm writing now a box before going to the cystic fibrosis features. If I write that respiratory system plus GIT means gastrointestinal system involvement, the long list of diseases, very specifically the respiratory disease are the bronchiectasis, and GIT disease is an malabsorption. If I am writing the malabsorption, so I am writing here bronchiectasis plus. So if a patients come up with the malabsorption bronchiectasis, I am saying sometimes malabsorption is nothing but M4, just write the M, just reverse it, W, M reverse it, W. Alright, weight loss, steatorrhea, weight loss, just write it down, diarrhea and steatorrhea. So malabsorption means the weight loss, diarrhea and steatorrhea. Say with me, malabsorption means, ma'am, just reverse. So yes, once again, that is weight loss, diarrhea and steatorrhea. Means the patient having the bronchiectasis along with the malabsorption, at least this syndrome, if the patients come up, we need to think about the first diagnosis, the cystic fibrosis, and second diagnosis, the hypogammaglobulinemia. Hypogammaglobulinemia, if you write in a short form, is an HGG for discussion, so it will be helpful, alright. So yes, once again, having a bronchiectasis with a diarrhea, steatorrhea, weight loss, think about, yes, the cystic fibrosis is the most likely diagnosis first, and second is the hypogammaglobulinemia. Now I'm talking about the another box for the cystic fibrosis. Is the cystic fibrosis. Yes, it is written cystic fibrosis. Of course, in your notes you see the chest infections, recurrent chest infections. If I am writing cystic fibrosis is nothing but C for chest infections, in another ways that will be helpful, means the bronchiectasis we are talking about, recurrent chest infections. And F4 is once again the failure to thrive. If I am writing, yes, the failure to thrive. And failure to thrive means the GIT symptoms. So bronchiectasis means the respiratory tract. And failure to thrive means once again diarrhea, steatorrhea, weight loss means the GIT symptoms. Means I am talking about the GIT. So yes, in that way also we can write a long list of features. Yes, cystic fibrosis management. I would like to discuss this one also as well here in this discussion. Management of cystic fibrosis involves a multidisciplinary approach. Key points that regular, at least twice daily, chest physiotherapy and postural drainage. Yes. So yes, the postural drainage and physiotherapy, circle the physiotherapy and postural drainage. Patients are usually taught to do this. Deep breathing exercises are also helpful. So deep breathing exercise, high calorie, including the high fat intake. So circle high fat. vitamin supplementations, pancreatic enzyme supplements taken with the meals, and heart and lung transplantation is a treatment, all right, for the cystic fibrosis. Another box of the cystic fibrosis management. Cystic fibrosis management. So the same thing, the sputum management, all right, as we have done. Yes, the physiotherapy, as well as the postural drainage, along with antibiotics that we are giving. Same thing here, right? But a very specific things which is sometimes very encountered in your exam, that is the diet. Talk about the diet, because we have seen the GIT involvement of the malabsorption. So initially that was advised that low-fat diet because of steatorrhea. Just remember, the diet is high-fat diet with high-calorie diet. This is the important instructions that we need to do. And this diet, you see, vitamin supplementation. So just write vitamins, as well as the pancreatic enzyme supplementation. So this is are given also the second bundle pack along with this high fat and high calorie diet. And of course, this cystic fibrosis is a congenital disorder. The main treatment is the heart, lung, yes, transplantation. So heart and transplantation. I'd like to discuss another topic here, an important topic, another disease causing bronchiectasis, that is ABBA, all right, allergic bronchopulmonary aspergillosis. Very hot topic, as we have seen, this is an immune overactivity causing this ABBA. So we are discussing another box that will be helpful, allergic bronchopulmonary aspergillosis. So I'd like to read what is written in your notes, my dear. Yes, allergic bronchopulmonary aspergillosis results from an allergy to Aspergillus spore. So allergy, circle Aspergillus. Sometimes the clues can be given in the history of bronchiectasis plus eosinophilia. So circle bronchiectasis plus eosinophilia. Features are bronchoconstriction like the wheeze, cough, and dyspnea, and bronchiectasis proximal. Investigation include the eosinophilia, fleeting chest X-rays, and positive rust to Aspergillus. Circle the rust and Aspergillus, eosinophilia circle, and positive IgG precipitants, not as positive as in Aspergilloma, and serum IgE raised. All right. Management steroids and itraconazole is sometimes induced as a second line agent. So steroids is the first line. I'm writing a box for the allergic bronchopulmonary aspergillosis. I'm writing A for allergic. We need to remember A for asthma, my dear. Asthma is responsible for causing this raised eosinophilia. Remember, the first topic that you go through, right? Asthma plus eosinophilia, the first diagnosis is the Shastro syndrome. Second diagnosis is the ABBA. Yes, this is asthma plus eosinophilia I'm writing. And also allergic means, yes, the serum IgE level is increased. Bronchopulmonary aspergillosis. So the word, the broncho, you can remember this is broncho means bronchiectasis. Pulmonary, the word will be helpful. P for pulmonary. Just write it down, the pulmonary infiltrate on chest x-ray. Pulmonary infiltrates in the chest x-ray. Sometimes said that the transient infiltrations in the chest x-ray. And A for aspergillosis, so evidence of aspergillosis should be given. Aspergillus evidence is said that there is the aspergillosis evidence, that is within the bracket AST, aspergillus evidence, means the US test in aspergillus, means RUST, positive RUST, means radio allergosorbent test. And also positive IgG precipitants. So this is the box will be helpful for allergic bronchopulmonary aspergillosis. And regarding treatment is a small box that I am giving, ABPA treatment. ABPA treatment, of course, ABPA is steroids and itraconazole. Steroids, itra. Just write it down as a box treatment. Steroids is the first line. Its treatment is given. Sometimes it's coming, right? The first line, and this is second line. Treatment is the itraconazole, long term itraconazole. I'd like to discuss another topic, that is aspergilloma. As aspergilloma is a fungus ball which often colonizes an existing lung cavity, secondary to tuberculosis, lung cancer, or cystic fibrosis. Usually it's asymptomatic, but features may include the cough, hemoptysis, and investigation is the chest X-ray containing the round opacities, high titers of aspergillus precipitans. I'd like to say the aspergilloma here, a separate box of aspergilloma. The word itself says that oma means is a tumor, right? So that is called the aspergillus fungal ball within a cavity. So aspergilloma is nothing but within a cavity. So aspergilloma means a cavity. This is the box. That would be helpful. What does it mean? I'm saying, so this cavity can be secondary to this secondary cavity to C for cancer, just write it down. C for once again the cystic fibrosis, and C for once again chest, just write it down, chest, TB. So these three C will be helpful, my dear. The clinical features of aspergilloma, once again C for cough, plus minus hemoptysis, H, I'm writing. Investigations once again showed that chest X-ray, once again chest X-ray, showed that a rounded opacity means cavity containing rounded opacity. And the most important investigations is rising titers of IgG precipitants. IgG precipitants means antibody is so high in contrast to the allergic bronchopulmonary aspergillosis. So this is a bit of differentiating features here. You see that this is a single arrow up, this is the triple arrow up. Another topic that I would like to discuss, my dear, this is called Cartagena syndrome. Cartagena syndrome, also known as primary ciliary dyskinesia. So Cartagena's, once again, you see here, that is Cartagena syndrome. Another name is a primary ciliary dyskinesia. Primary ciliary dyskinesia was first described in 1933 and most frequently occurs in examinations due to its association with the dextrocardia. Quite hard sounds, dextrocardia, small volumes complexes in the latter lids. Dextrocardia complete sinusitis inversus, bronchiectasis recurrent sinusitis, and subfertility secondary to diminished sperm motility and defective ciliary action in the fallopian tube. So once again, my dear, I'd like to give a box here. That is the Cartagena syndrome. I'm writing box here, a small box of the Cartagena syndrome. Cartagenas is a itself, Cartagenas, you see the car. So we need to know the Cartagenas means the cardiac. Means dextrocardia. So dextrocardia, we can say sometimes Cartagenas, once again, the complete situs inversus. So this Cartagena syndrome, of course, they will come up with the the name is a primary ciliary dyskinesia. They will have both the upper respiratory tract infection and lower respiratory tract infections recurrent, leading to upper respiratory tract recurrent infection means recurrent sinusitis, and lower respiratory tract leading to the bronchiectasis. And of course, the primary ciliary, because of ciliary dysfunction, leading to subfertility. The box. Yes, my dear, I'd like to discuss a little bit more discussions all together. That will be helpful all together. Yes, my dear. Just follow me. I have said that the first box, the bronchiectasis, the most common is the cystic fibrosis. And this is nothing but a vicious cycle of the infections and obstructions. And infections childhood pneumonia, pertussis and measles, and tuberculosis. Obstruction, foreign bodies, lymph nodes, and cancer. So this is the bundle pack. And next, the immunodeficiency. I said the hypogammaglobulinemia as well as the IgA deficiency is a congenital and acquired cause. Of course, there is an HIV. Immune overactivity, I said, then allergic bronchopulmonary aspergillosis that we must remember. And congenital causes are the cystic fibrosis and ciliary dysfunction. Primary ciliary dysfunction is nothing but the Cartagena syndrome. Another one is the Young syndrome. And another one is the yellow nail syndrome. All right. So I'm saying Young syndrome within the bracket of Young, always Young, just write it down, infertility. In contrast, as we have written, the Cartagena syndrome is a subfertility. So yes, bronchiectasis with infertility. Think about the Young syndrome. First, bronchiectasis with the subfertility. Think about, yes, this is the Cartagena syndrome. A bit of differentiating points. And yellow nail, of course, there will be the yellow nail. Just within the bracket, just write it down. This is, there will be lymphoedema is another point that you need to know. So these are the causes of, right, the bronchiectasis. But the most important causes that you need to talk. That is the hypogammaglobulinemia, we already know, ABBA, cystic fibrosis, and carcinogenous syndrome, you see, all together that we need discuss, right? The second box is the bronchiectasis management, the sputum management. These P and P's means the P management, physical training, inspirative muscle training, especially very specific talk, inspirative muscle training in case of non-cystic fibrosis. It is said the non-cystic fibrosis, specifically said the inspiratory muscle training is more beneficial. And of course the postural drainage. In contrast, the cystic fibrosis management, of course, this is physical training and postural drainage, of course. These are important. So, along with the antibody, the similar, but especially the inspiratory muscle training is non-cystic fibrosis, bronchiectasis is more beneficial. Third box, you see a box of the respiratory and tract and also GI tract, respiratory, the bronchiectasis and malabsorption is a DDE is the first thing we need to talk about cystic fibrosis. Second is the hypogammaglobulinemia. Fast means fast, always think about it. So the next, once again, the fourth number box that we have talked, the cystic fibrosis. Feature C for chest infection, F for failure to thrive. Remember C for chest infection, F for failure to thrive. So yes, cystic fibrosis, failure to thrive means the GIT problem. Yes, diarrhea, steatorrhea, and weight loss, leading to respiratory tract, once again, the GIT combinations. Number 5, that we are talking, right? Number 4, number 5, the cystic fibrosis management. Yes, the definitive management is the transplantation, my dear, cystic fibrosis. Is a cystic fibrosis management is a heart-lung transplantation. Yes, along with that, the sputum management and dietary management that we need to remember. Diet means high fatty diet and calorie, vitamins and pancreatic enzymes. Remember. Number 6 is an allergic bronchopulmonary aspergillosis. A for asthma, eosinophilia, and serum Ig level. Broncho is a bronchiectasis. Pulmonary means chest X-ray, pulmonary infiltrates, I said it. And aspergillosis, yes, the evidence of aspergillosis. Aspergillosis, A for AST, all right, allergosorbent test, but RAST is a, right, RAST. Another one is the IgG positive precipitants. So within the bracket of asthma, you can write wheeze, I said wheezy. Bronchiectasis means profuse sputum. If the scenarios are come wheezes along with profuse foul-smelling sputum. So think about allergic bronchopulmonary aspergillosis means asthma and bronchiectasis together. So yes, the A for asthma, B for broncho means the bronchiectasis. Pulmonary means, of course, the pulmonary infiltrates, and aspergillosis means aspergillus evidences. Yes, my dear, this is very important. And another small box that we can write here, that is bronchiectasis plus raised eosinophilia equal to ABPA. That will be helpful. Like bronchial asthma plus eosinophilia, first diagnosis, the Shastro syndrome, second diagnosis, the ABBA. And bronchiectasis plus eosinophilia, the first diagnosis should be ABBA. That is very important. Clues, my dear. Yes. Number 7 box. Aspergilloma is a xyloma. Is a tumor ball, a fungal ball in a cavity, in a cavity. Cavity caused by cancer, cystic fibrosis, and chest TB. That will be helpful. And these are come up with the C, means the cough. So the aspergilloma is nothing but the C rolls. With hemoptysis and chest X-ray showed that cavity containing rounded opacity, along with the very high titer of IgG precipitants, is the antibody. And last, Number 8 box is a treatment of right, the allergic bronchopulmonary aspergillosis. The treatment is the first line, the steroids and itraconazole, just remember. And 9 box is once again the cardiogenic syndrome, primary ciliary dyskinesia. So ciliary dysfunctions, so upper respiratory tract, lower respiratory tract, upper respiratory recurrent sinusitis, lower respiratory tract, bronchiectasis, remember. So once again, cardiogenic cardiac, so the cardiogenic is the cardiac means the dextrocardia, remember. Complete situs inversions and also ciliary dysfunction linked to subfertility, ciliary subfertility. So cardiogenic cardiac, remember. In contrast to the other syndrome like the Young syndrome, no cardiac problems, only infertility. And yellow nail syndrome, no cardiac problem, bronchiectasis, but they have only the lymphoedema. My dear, these colorful discussions, a bit of summary talk will be helpful. So start with this bronchiectasis, the cystic fibrosis, hypogammaglobulinemia, allergic bronchopulmonary aspergillosis, all together that we need to talk. Second box is the bronchiectasis management, the PP, all right. And respiratory and GIT involved in the CF and HGG means hypogammaglobulinemia. CF is the CF, chest infections and a failure to thrive. Allergic broncho ABPA is nothing but ABPA. Treatment is steroids and ITRA. And next is the CF is a heart lung transplantation, but the most important is the fat. CF, fat. CF, cystic fibrosis, C fat, remember? Means fatty diet, high fatty diet, remember? And last is the aspergilloma, is the C for cavity, right? There's a fungal tumor within the cavity, cough cavity containing round opacity, and also the IgG precipitance raised. And last is the cardiogenic, is the cardiac, dextrocardia. I hope that, my dear, you enjoyed very, very well. So thank you very much.